Okay, good evening, everyone. This is Priyanka here from the PCOS Society of India. I welcome all the panelists, audience for today's Power Pack panel discussion, in which we are going to debunk some common myths and misconceptions in PCOS and give you real facts about PCOS. So, this panel discussion has been brought to you by the PCOS Society of India. The PCOS Society India is a multidisciplinary society. It has a mix of specialists like gynecologists, endocrinologists, dermatologists, and there are other healthcare professionals also like nutritionists, physiotherapists, psychologists who regularly deal with PCOS patients. So, we conduct and organize lectures, seminars, and meetings by invite experts in the field of PCOS. Now, through our outreach program, Vijayata the Winner, which has been supported by Philips, we are creating awareness about PCOS in general public. These awareness sessions are being held both virtually and physically in various organizations, universities, corporates across India. Through our sessions, we educate girls and women about PCOS so that they are aware about its symptoms, causes, and health implications so that they are equipped with knowledge that is needed for early diagnosis, management, and lifestyle modifications to improve their overall well-being. So today we have Dr. Kanthi Bansal ma'am, who is going to moderate today's panel discussion. She's a senior gynecologist based in Ahmedabad. She's a director of Safal Fertility Foundation. She's a pioneer in the field of assisted reproduction at India and Gujarat. She's also a pioneer in artificial intelligence, virtual reality, and haptics in assisted reproduction technology. She's been awarded by Royal College of Obstetricians and Gynecologists. She has a specialization in management of infertile couples, PCOS, endometriosis, and women's healthcare. She has published 12 books on her area of specializations and which are being used as a reference by medical students and practicing clinicians. She's also a guide to PhD students and a visiting faculty at Gujarat University. She has successfully trained more than 2,000 gynecologists in the field of PCOS, endometriosis, infertility management, and ERT. Dr. Kanthi Bansal, ma'am, I welcome you for today's panel discussion. And I would request you to welcome our other panelists and take over the discussions. Over to you, ma'am.
Thank you so much, Priyanka. And yeah, I have very well-known gynecologists and also infertility specialist with me. One of the best person and the best doctor, sincere most doctor is today with us, and she has so much knowledge in PCOS, and she's a member of our PCOS committee. Her name is Dr. Shashikala Sahu. She's from Ahmedabad. She's MD in OB&GY, senior consultant in our Ahmedabad city. She has private practice in Bhagyodaya Maternity Hospital from 30 years. When she was small, she was with me. You know, she's sort of my student. Now she's at par more than me in her practice. Really very proud of my girl. And her main interest in infertility is sonography and high-risk pregnancy. Yes. Now we have very, very beautiful, enthusiastic, and very active sort of an educationalist because she's having so many programs in Haryana and in her vicinity. She is Dr. Jyoti Malik. So she's the director of Roots IVF and Fertility Institute, IIMS. Key positions are chairperson, Haryana ISAR VP of Haryana OBGYN, secretary IGE Haryana, joint secretary IGE. Awards are Women Transforming India Award 2024, Women Achievers Award 2023, Haryana Chakitsak Gaurav Award 2022, multiple Six Sigma and API Abdul Kalam Awards. Hats off to you, Jyoti.
Thank you so much. Thank you, Dr. Kanthi. I think we'll move forward. We are waiting for the discussion to happen.
So a lot of publications she has and leadership qualities as well. And you can go forward to Sabita's. Yeah, Sabita Dixit is another very well-known IVF specialist from Allahabad. And in fact, she's also one of my, I can call student of ART and IVF. So she's done her MS OBGY from Patna Medical College and MRC OG from UK. She's the managing director of Dixit IVF and Test Tube Baby Center. awards and recognition, brand icon, unsung hero, youth icon, and felicitated by Dainik Jagran and various social organizations for contributions to it. She's very sincere and dedicated to her work and have very successful IVF center in Allahabad. Proud of you, Sabita. Yeah. Now I have one of my favorite girls. Uh, Very, very hardworking, and she might be one of the youngest here, but then she does so much for all the organizations. A very, very sincere girl. She's president-elect of the Bhopal Obstetric and Gynec Society, founder president, and of ISOPAR Bhopal, national executive member ISAR, and coordinator of Infertility Committee. Published 50 plus international research papers, contributed to 8 book chapters and delivered 500 plus talks in national conferences. Actually, I remember every time I used to go to ESRM and other foreign conferences, Monica's article will be there. So they're very good in research work. And recipient of ISOPAP Hall of Fame 2023 ISAR Dronacharya Award and Women Entrepreneur Award. Organized and chaired major national and international medical conferences, convener of ISAR Perfection Fox's Symbiosis webinar series, and actively involved in mentorship, academic research, and medical leadership. Welcome, Monica. So now, dear friends, especially all those who are really eagerly waiting to learn about PCOS and understand really what is PCOS. Today we are having a very, very interesting topic on PCOS regarding the myths and misconceptions. But first of all, let's understand, understanding PCOS is really difficult, but let's really simplify this topic. And PCOS is what? People call it POX also. P stands for poly, C stands for cystic, and O for ovarian, and S for syndrome. So it's an acronym for that. And 1 in 5 Indian women, actually now it's known that 1 in 4 Indian women suffer from PCOS, but worldwide the number is like 1 in 10 to 15 women suffer from PCOS. So it's just very, very high. So it can start at any age with the first occurrence of menstruation, and majority of the women are diagnosed between the age of 20 and 30 years. And what is really very common in these PCOS women is infertility. That is, they find it difficult to conceive a baby. Yeah. So now, with this short introduction, I would also like to tell you all that there's a lot of irregular menstruation. That is also one of the commonest cause. Initially, we used to call it as a polycystic ovarian disease, and still now many of the doctors all over the country, they still call it as PCOD, but it's wrong. Why is it wrong? Because disease is just one part or one organ. In PCOS, it is a syndrome because multiple organs are involved. Like, the skin is involved, the liver is involved, the reproductive system is involved, the psyche is involved, patients are also having depression, etc. So it's there's multiple problems in PCOS, and that's why we call it as a syndrome. So now we go forward with our panel discussion. And first, I would like to ask a very simple question to Monica. What is the most common myth, Monica, of PCOS? As the name itself suggests that polycystic, right? So what is it? What is the most common myth about PCOS? Can you hear me? Yeah.
Yes, ma'am. Yes, ma'am. Sorry, there was some problem with my internet, but now I think I'm audible, ma'am.
I can see you twinning. I can see you on 2 screens.
I think it's 2 of me, that's why. Is my voice echoing, ma'am?
No. But only
Okay,
that's okay if you're seen 2 times.
Okay, ma'am. So, ma'am, the most common myth about PCOS is that it's a disease. The commonest thing which enters the mind of a woman who is, having symptoms or syndrome of PCOS is, madam, I have got a disease. So this is a commonest myth which we have to remove from the minds of
Okay, I think there's something wrong with your sound system. Mike, sometimes you're freezing, or maybe the net connection is not all right. So, anybody else wants to tell about this?
Hello, ma'am.
Yeah, Shashi, come on.
It's not as
Good afternoon to everybody. Sorry, joined little bit late. I think the internet, some problem with the internet connection to Monica. I just wanted to, as she was telling, people think that it's a disease, it's a myth. I don't think it's a myth. We have to take it considered as a disease. It's a syndrome. Syndrome is a combination of too many diseases. And the general concept is, if there is no disease, there is no treatment. No need to go to the doctor or the associated persons. It's better if they take it as disease, so that they will come to the related person who can take care of that lady. Syndrome means combination of too many things. And
No,
makeup.
Shashi, I was not asking about syndrome and disease. Definitely, this is a syndrome and not a disease, that is proven. What is the commonest myth regarding the polycystic ovaries? What do people feel when we say polycystic? Yeah, generally what is the myth in girls that
Different
the
tumor
ovaries
or
are
gant-like thing in their ovaries.
correct. They feel that there are cysts in the ovary. But Jyoti, do you think they really have cysts, or is it a myth?
No, actually, it is a myth. These are the follicles, and it is not that there are some very big cysts that they should feel scared of. The word gant itself scares them when we call it, when it is heard in that sense, कि ओवरी में गांठें बन गई हैं. So ओवरी में गांठें बनना मतलब it sounds very scary, though we have to tell them that it is something which has a lot of implications regarding their hormones, their weight, and everything can be corrected over the time, because it will manifest in different parts as differently.
Yeah, I think you hit the nail very correctly, Jyoti. I'm really happy about it. And why is this myth? Because this myth is because we doctors or clinicians have really given a misnomer. We have named it as polycystic. So to the layman, they feel that it's cystic. So if recently the International Regulatory Board of PCOS, they are all trying to change the name of this PCOS. They're not yet done it completely, but the meetings are going on, and ultimately there's going to be a change in the name. Okay, Jyoti, you can continue, because the next question is yours. What's the big myth regarding weight? वजन वजन का क्या मिथ है? क्या लोगों को लगता है वजन के बारे में, जो लोगों को PCOS?
People feel that, okay, PCOS means something very has to be overweight. The girl has to be overweight. She will be obese. So basically, we cannot say that all the PCOS are obese. It can be some of them, and therefore there could be even a delayed diagnosis, because people feel, I am not obese, how can I have PCOS?
Exactly.
So the myth is that PCOS, definitely the majority of the PCOS girls and women will be obese, but there is also a variety of PCOS where you may not be overweight. And
I think once again, you are really going on the right path. Yeah, there are two sets of women in PCOS or girls. One is the obese and the thin, lean PCOS. So so once when we say PCOS, generally people think that PCOS is the disease or the syndrome of fat people or overweight people or obese people. Excellent answer, Jyoti. Dr. Shashi, what's the myth regarding PCOS and pregnancy? What do patients think if they have PCOS? Will they get pregnant, or they become pregnant too many times? Will they have miscarriage? What do you think about your patients?
Yes, most of the time after 1 or 2 years of the marriage, most of the time they came inquiring that I have got PCOD. I will not be able to pregnant no of my own. Most of the time that it is very difficult for them to get pregnant. That is the myth.
Yeah,
He explained that it's not exactly the little bit of difficulties can be there because in PCOD there is dysfunction of ovulation. The person is not ovulating properly every monthly, so it can be corrected. It is not a very big deal, big thing that cannot be corrected. She needs little bit
exactly.
of assistance in the form of some oral ovulation inducing agent, sometimes IUI, or sometimes in vitro fertilization if some associated other factors are there. She needs little bit of help and she can become pregnant.
Exactly. So, very correctly, you have told all the points. I would just like to add one more point here, Dr. Shashi, that these patients also can conceive naturally without any medication, without anything. I still remember one of my patient who had come to me, and she did have PCOS, obese patient, and for many years she was not able to conceive. So I gave her, she was from a poor economic condition, and I had given her, I think, Metita. I don't exactly remember either Metitol or just Metformin I had given. I told her, you start this and you come once you get your menses, and I'll give you ovulation induction drugs. She went off to her gam. After some 9 or 10 months, that man came. That man works in near our hospital only. He brought a packet of sweets. I said, what is this for? He said, we also didn't know. I scolded, why didn't you bring when she had a menses? He said, no, but she delivered at home only. We also didn't. She was so bad, so bad. She just kept taking those Obemet or whatever I had given, and she became pregnant and she delivered, and nobody knew that. This case I can never forget. So they just conceive and they get kids also. That is the beauty of PCOS sometimes. Okay, now
Yes.
I want to the dancer, the beautiful girl from Allahabad, Prayagraj. Oh my God, were you able to get out of your clinic or no? Sabita. So your question is myths about actually getting pregnant in PCOS women. What do you think? What do these patients of, not patients, women or girls of PCOS think that is it difficult to get pregnant? How will they get pregnant and all that? Or you can put light on weight, the weight reduction, what it does. Yeah. Unmute, 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 Sabita.
Okay.
Good.
Yeah.
Yeah.
Yeah, ma'am. There are many myths regarding PCOS and pregnancy. Most of the time, when the patients enter the room and they say, Madam, PCOS, now will I conceive or not? And I'm trying for this much long time and I'm not conceiving. Long time in Uttar Pradesh, that means 5 months or 6 months of marriage is a long time. And everyone is putting pressure on her. And then when she comes, she needs help regarding what's her hormonal status and what is actually her ovulation cycle, whether she's ovulating or not. तो जो myth है उनको यही रहता है कि we can't get pregnant and once pregnancy if it is there I may face complications because polluted awareness regarding PCOS is much more on the social media and that is creating problem. They become very anxious and then they keep on asking questions. What will happen? Should I continue with my pre-treatment medicines afterward also after getting pregnant? And what about weight and this and that? Exactly, ma'am. What's your question is what the myth regarding what you are asking, ma'am? What you're asking?
Yeah, actually, it is a little bit of repetition to the previous question that Shashi answered. So
Yeah.
I think I agree with whatever you said, but weight reduction is a big pointer as far as pregnancy and PCOS is concerned. But we
Definitely.
have to explain the patients regarding the lifestyle modifications or lifestyle interventions, which is very, very important. And
Yeah,
also,
ma'am.
yeah,
Weight reduction, I say that at least 10% of the body weight reduction is required. And lifestyle modification, exercises, deep breathing, her good diet, these all are going to help her to conceive naturally also. She may
so
not
we
require
have,
any treatment.
Savita, we have to also explain to the patients that by doing all this, what happens? There is hormonal imbalance which was
Balance. Yeah.
gets the balancing of
Yeah.
all the reproductive hormones, and then they conceive. And then
Yeah.
they may have a little bit of help from the clinicians. Sometimes they conceive spontaneously also,
Spontaneously.
sometimes those and very simple treatments also they can conceive.
Yeah.
And now we go to Monica. What is the myth regarding the type of disorder PCOS is? What do most of the girls feel that what type of a disorder or a health issue is PCOS? What do you think?
I hope I'm audible now.
Yeah, very much.
So, ma'am, actually, like I answered in the first question, though I might have not been audible,
Yeah.
the commonest conception or misconception by these women is that it is a disease of cysts.
Hmm.
So it's a disease which we have to clear that it's not a disease. And secondly, they feel that that cyst is something abnormal, which is, filling her ovaries. Sometimes they don't even know where the cyst is. They just think it is cyst. They cannot correlate the cyst with the ovary. There are patients who have come to me where they have undergone surgery for uterine polyp, and they have come to me that cyst has been removed from the ovary.
Oh,
So, ma'am, the counseling is so poor in some parts, though I will not say anything about my colleagues, but probably some, difference in cyst and polyp. The word cyst should be removed from the polycystic terminology. I feel that there has to be some sort of change in the name only. Because now the newer criteria say that not every ovary of a PCOS woman is having that typical polycystic pattern. So if we remove this term from the name of the syndrome, then probably that label of polycystic will be removed from the people's mind once and for all. Like when
yeah.
Allahabad's name was changed to Prayagraj, we
Yeah.
thought that we will never say Prayagraj. We thought we'll always say Allahabad only, but now saying Allahabad is difficult, saying Prayagraj has become easier.
It's become world famous. Oh my God. So now, adding a little bit more to your answer, what I meant with the type of disorder, generally the laymen or other people, they think that PCOS mainly means, as you said about the name and all that, I think we discussed in the first question. In this, mainly, they think it is the disorder of it's a reproductive disorder. But truly speaking, reproductive disorder is just one minor part. Major part are so many other things like, it could be a metabolic disease, and it could be a skin problem, anxiety, depression. There's so many things involved in this PCOS. That's what I would. So now, Dr. Jyoti, most common myth regarding curing of PCOS with which medicines or pills? Do these patients think that, okay, if we take this medicine, we'll be cured of PCOS?
See, yeah, it is again a myth, Dr. Kanthi, that if they take this medicine or if they take pills, they'll be cured. It
You
is,
said the second one. I wanted that because most of these college girls, and I've educated many of these girls, and they all think that pills, you
yeah.
told that you occurred. Yeah, it's correct.
Yeah.
Yeah.
So it is not that the medicines are going to cure, they are going to cure them temporarily. Means
Mhm.
for the time being, the hormonal imbalance which has occurred will be taken care of by the oral contraceptive pills, or let's say the hormones that we are giving them through these OC pills. But basically, it has to be everything coming together. It is not only that, it has to be their change in the lifestyle, their other eating patterns, the exercise part that they have to take care. So everything together will work, and it is only for the time being that if we give these anti-androgen pills, then okay, the hirsutism part or the acne. So I mean, it is just for this time being that it will help them, but
Yeah.
then it is not a long term thing. And for the long term thing, they have to take care of their metabolic syndrome or the metabolic part. The insulin have to be taken care of. Maybe they have, by the exercise that can be done, and also the cardio. There, I think the other parts that, let's say, even they have to keep getting their
So,
cholesterol and things like
yeah.
that.
So, Dr. Jyoti will come to that later. So, actually, you told the right thing that people think that if they take OC pills, they get cure of PCOS. But what does OC pills do? It just regulates the menstrual cycle, and the symptoms, they're free of symptoms, right? But we have to make them understand that to really cure or to really get into the depth of treatment of PCOS, we have to individualize the each patient's management. It's different for each patient. Yeah. So now we go to Dr. Shashikala. There's some myth regarding carbohydrates and in PCOS. Can you put some throw some light? It's regarding what patients feel about carbohydrates and PCOS.
Yes, that is the very first thing that we encountered during the management of the PCO patient. We are repeatedly telling them that you have to reduce weight, you have to reduce weight by 5 to 10%. And for reducing weight, first and foremost, burnt all falls on carbohydrates. So they have to reduce their carbohydrate. But people think that they have to totally evaporate carbohydrate from their food. They don't have to take the carbohydrate. But it's a big myth. Carbohydrates are major source of energy to our body. What I explained to them is that it is the type of carbohydrate and the amount of carbohydrate that matters. The carbohydrates which have got high endemic index, like direct sugar, caffeinated drinks, they will increase your insulin resistance because they have got a very high peak after you consume that sort of things, and that will further increase your weight gain. The carbohydrates which have got low glycemic index, like fruits, vegetables, legumes, that will have your not having the spike after you consume that kind of food, and that will not increase your insulin resistance. And most important thing is the portion of carbohydrate. I explain generally to my patient, you eat everything but have a small portion. You can have 2-3 bhaji for the test, but you cannot have 10 bhaji. That will increase your body weight. You can have a small scoop of ice cream, but you cannot have kasata or the family pack at one time. And
so, Shashi, I think you've done excellent answers. I never expected. I thought you may not tell, but you are really, really good in PCOS, and I'm really proud of you. That once upon a time I had you. I want to share something about Shashi now. I used to have a huge OBGY practice. So in the nights also I used to go because the patients were very demanding. But then this Shashi used to tell me, at no cost are you getting up in the night when I am there. When I am, so she used to not allow me to do the night duty, even though when I was quite young, I was in my 30s, 40s that time. So she is Shashi, and very good. I think you know in and out of PCOS, Dr. Shashikala. And I'd like to add one thing about carbohydrates. You said very rightly, they should focus on complex carbohydrates and fiber instead of completely, abolishing or eliminating carbohydrates. And like what you said, eat less and all that. I give my patients a cheat day. Cheating day.
yes,
Everybody likes to cheat. Who doesn't like to cheat? Even I like to cheat. So
yes,
once in 15 days, I tell them, no, don't eat everything that you like. Just eat a little bit of pizza. You know,
mm.
after 15 days, if you like ice
Portion
cream,
control.
yeah, yeah, that's it. So now, Sabita, what
Yeah,
is
ma'am.
Common belief as the cause of PCOS. What do the people think that why does PCOS occur at all?
Actually, I think they don't think anything. They never say that why does I have this thing. We have to explain that, okay, this is with you and you need to understand this, that it is with you, and most probably it is your genetics. And today's lifestyle is also very much responsible, because kids are getting sedentary and they are having faulty diet, and sitting job is also there, and the children are not playing outside. These all factors are causing this PCOS on a rise, and you may be one of the victim of this PCOS. Or otherwise, if someone is of normal weight, then we have to make them understand that okay, it is your genetic makeup that you are gifted with this thing.
Yeah, so basically, people feel that PCOS is caused by eating junk food and it's a lifestyle disorder. But as you very correctly said, it is of course a genetic problem which is there, and it's not by eating junk food and all that. And eating junk food will make this disorder
Contribute.
worse. But this is not the sole cause of having this disorder. Yeah. So I think are we done with all the questions? Yes. But still there are.
And ma'am, I think that in PCOS we have
Yeah.
in PCOS we have two parts: the wellness part and the illness part. The wellness part has to be taken care by the patient herself, and the illness part has to be taken care by us. What I feel, wellness part, that holistic approach, whatever we say, that avoid junk food and have a good sleep pattern, exercise, doing all this stuff, and having controlled weight. This is the wellness part. That also, this is a situation where both wellness and illness part both contribute equally. Rather, the wellness part plays major role.
Yeah, I think staying in Prayagraj has given you a lot of influences of this holistic approach.
Yeah, right now.
Okay, did I ask you this? No, just a minute. I think we are done with all the questions and answers, but we can carry on with some myths. Once again, the not myths but misconceptions we can. So I would now like to ask you all. Anybody can answer. What are some common effective lifestyle changes for managing PCOS? Jyoti?
Yeah, so the commonest lifestyle thing is that one has to go, is the diet management that we've discussed. Avoid these complex carbohydrates, have food with low glycemic indices, and break your food into frequent meals. Eat a small plate, have all those seven colors, different colors in your plate, decrease the size of the plate. The whole family should eat the same thing rather than just putting one person to eat something else and the rest are eating the pizzas. So let everybody have the healthy food. So one is the diet part of it, and the second is the exercise part of it. So exercise means you have to, if you're obese, you have to lose weight. If you are thin, even then you have to continue exercises, so that even the exercise part will at least modify your will give a positive effect on the disordered hormonal milieu that is there occurring in the body. Then you have to maintain, if you have lost weight, you have to maintain that weight. So any form of exercise, and it has to be smart. The goals need to be smart, they need to be achievable, they need to be, I mean, can be attainable, and they are sort of realistic goals. We cannot just say ki go and reduce weight. We have to give them certain time frame, and within which they can do that thing realistically, rather than just putting the giving a very brief statement to them. So it has actually PCOS is a multidisciplinary approach. One, it has to involve your nutritionist, your physiotherapist, your physical trainer. Then you have, even if you have any skin issues, then the derma person comes into
It's
existence.
multidisciplinary.
Yeah. So
Yeah.
endocrine, if the endocrinologist can be taken into picture. So, and sometimes these girls, because of their overweight, because of hirsutism, acne, they are into depression. So we should not forget that we have to counsel them very thoroughly. And
Actually, before depression
psychological
comes stress.
stress,
They
yes,
have a lot of stress and low feeling about themselves, suicidal
the
tendencies.
body image part that they
Body
feel that,
image, yes,
yeah.
and in the college and all, they feel so shy. They're, so they have lot of psychological issues and all that. So stress management is also important. Now we are getting few questions from the delegates also. So before that, shall I give my mantra? What I tell my patients of PCOS?
Yeah, sure.
Yeah. So, first of all, we have to see whatever we tell them, we have to see that they follow it. If it is too complex, if it is too serious, if it is too monotonous, they're not going to follow it. They'll follow it for 2-3 days and they'll leave it, and they'll be the same. If you want them to be more effective, really show some improvement, then you have to do a lot of counseling to them. There's nothing wrong. Many girls are having this problem. That is first thing. The second thing, see, we are talking of so much of lifestyle management and all that. So we have to tell these patients that how do we manage the lifestyle? We have to do exercise. We have to get up. You have to explain to them the sleep rhythm, the circadian rhythm, and nowadays the recent this thing about PCOS is everything is happening in the brain. So they have to sleep at a particular time and they have to get up. That is the first thing they have to do. And if you ask all these patients of PCOS, they sleep at 12 o'clock, 1 o'clock. Nobody sleeps before 11 o'clock. They get up at 9 o'clock. They're working women who are working for international, IT companies. So we have to tell them whatever it is, you need these many hours, sleep at one particular time, get up at one particular time. That is the first mantra. Second one, to be very disciplined, keep alarm. You keep alarm. I tell my patients, keep alarm and to sleep and to get up, both. And to be disciplined, we as physicians, we have to be disciplined. I tell them my routine. See, I do this. I get up in the morning at 5:30 when I'm working the entire day, and then but sleeping at right time, having proper food, proper fruits, salads, and this katol and all. More protein. Have as Shashi and Jyoti said, you have even carbohydrate to some extent. So we have to teach them, be very sympathetic and see that they follow you. Call them frequently. Tell them to have a diary and note down. All the small things also really matters. I think we should take up the questions which are coming now. Yeah. So who will answer, Shashi? Any herbs which will be useful for hormonal imbalance, ma'am?
There are certain hormones which are said to be effective herbs. Exactly, I don't remember the name, but something in the ananas, pineapple, some chemical is there, and some herbs are made from that. Some Ayurvedic people are giving that. Actually, I have never given, so I don't know. But it is said that something is there in the pineapple, some enzyme or something is there that helps in weight reduction and helps in PCO patients.
I think there is berberine is there. Then even these mannitol are there.
Berberine is it, and that something recently Jyoti and Monica.
There are teas which have these maybe I'm forgetting the name, but fenugreek was fenugreek, aloe vera. People have tried all these for PCOS.
Yeah,
Even
but
turmeric. Even turmeric.
turmeric, and even methi, no? Methi,
Methi seeds.
Fenugreek.
methi seeds. It's good for diabetes, everybody knows, but then it's good for many other things also. So maybe actually, I'm so sorry because we're all allopathic, so
Even cinnamon, people say cinnamon is very good for this.
Cinnamon in the night, if you put it in water and drink that water in the morning, it's very good for metabolism.
Exactly. It increases the
It is good
metabolism.
for weight reduction. Since cinnamon is
weight reduction, but even overall health, I think cinnamon is good. But basically, we are allopathic doctors, and maybe we do not know much about the herbs. So we won't be commenting on herbs that much. But anything with allopathy, I think we'll be more. So now this is this question, second one. I think we should go. Are PCOS and PCOD same? It is not the same. D is for disease, and it is not used nowadays because disease pertains to one particular organ. Now the right word for polycystic is the polycystic ovarian syndrome, because as I told you, it affects many organs. It affects the skin, it affects the the reproductive system, the mental health, and so many other things. And so it is not a disease. Now, in obese patient, how long tablet metformin can be given? See, in obese patient, tablet metformin is not given for obesity as such. It is given for other medical reasons, but under the supervision of a proper clinician or a PCOS specialist or a gynecologist. If you are obese, you can combine Obimet with her or his instructions, and this Obimet or metformin is the name of the medicine. This can be taken for at least 5 years. Research is there that 5 years you can take, but in diabetic patients we are giving it for lifelong. So there is no harm giving this
Actually, I think Dr. Kanthi, why we are giving metformin is because hyperinsulinemia is the culprit.
Hyperandrogenism is there, and hyperinsulinism is there.
Insulin resistance, hyperinsulinemia. So that is why the metformin plays a role by reducing the insulin levels, and thereby the hormones being taken care of.
But the question is how long? So it can be taken for long term is my answer. And some good news for people who are using metformin. I read somewhere, please correct me if I'm wrong, that metformin causes the memory to be very fine. That's what I read. Okay. And now, so that doesn't mean that all of you who are listening go and start metformin. Please, it's not like that.
Another common question.
And initially, when you start metformin, you have to go take in very tapering doses. I give half tablet BD, OD for 3 days, half tablet BD for 3 days, and then 1 tablet BD for thereafter. One of my patients was so sensitive, she was not able to take, and I had to give her. So I started with pediatric syrup for her, pediatric syrup, and then slowly after 1 month she started taking in the small doses of tablets. So don't take immediately, and you have to tell your patients when you give metformin, take after food and with 1.5 glass of water. That is important. Then they won't feel nausea and all that.
Madam,
okay, now somebody can answer this.
Madam, we have to tell these patients that if you become pregnant while taking metformin, please continue. Don't stop.
Yeah, excellent. You're a silent killer.
No,
very nice.
Because sometimes they try to, they don't consult the doctor, they stop metformin, and there is association between stopping metformin and having early pregnancy loss.
Yes.
So it has to be continued. It will help the woman against GDM also, and it can be safely continued till delivery.
So now this is for Sabita. From which age we can start COC in adolescents?
From which age?
Age. कौन से उम्र से हम दे सकते हैं उसी प्लेस?
Okay. I think, ma'am, in adolescent pieces, most of the time they present a bit late, and we can start it from 15 to 16 years to regulate her cycles as her presentation is. What is the extent of her irregularity of her menses, and to control her hormonal milieu, we can start that.
Anybody
Once
else has
the
to?
epithesis
Yeah.
is closed, her
Guidelines,
height.
guidelines have come from ESHRE about adolescent PCOS very specifically, and OCPs are one of the mainline, frontline drugs for starting in adolescents, and it can be started. First of all, you cannot diagnose irregular periods for the first 3 years after menarche.
Yeah.
Once you say that after 3 years of menarche, if she is, because you cannot do ultrasound in adolescents, ultrasound is a no, AMH is a no. So only thing is clinical. So if you find 3 years have lapsed after menarche, and still this girl has got irregular periods and weight issues, and her guardian mother is concerned, and she's also concerned, then OCPs, low dose OCPs can be started very, very, easily and with proper counseling, and they are very effective.
Okay. So there are so
One thing,
many.
madam, sorry
Yeah.
to interrupt. One thing, they are nowadays, because of media, they are aware about the height and everything. So they ask the question. Once the girls, nowadays the girls are starting menstruating at the age of 9 years, 10 years. Suppose if we keep this guideline of 13 years, and she's looking like a small height, then the mothers are concerned about giving OC pills, and what about her height and all that.
No,
So it
OCPs have got
doesn't.
the height, madam. There is no effect on the height. There is no correlation
Estrogen,
between
OCP
and
estrogen, it helps. It will close,
The
having the earlier
fusion of
closure of
epiphysis,
dose.
metabolism.
the epiphysis has it can lead on to premature fusion and
Premature closure, yes.
See, the dose is very low.
yeah,
Hardly.
yes.
Yeah.
Can I make a comment here? There's so many questions. So let's keep these answers just one line. And Priyanka, maybe can we extend the time 10 more minutes?
Yeah, sure, ma'am.
Because there's so many questions,
Yeah,
I'm getting stressed because of,
Okay.
and my panelists are so
I think, ma'am, we can take only.
fantastic. They're answering in depth. Okay, so I want to answer one question. Somebody had asked, I don't know where it is because suddenly it pops up regarding probiotics. Do we give probiotics? I definitely give probiotics in PCOS. There is something known as dysbiosis in these PCOS patients. And I've seen that when I give these probiotics along with the other management of PCOS, then it's very, very effective, especially when patients are trying to conceive. Even then, and even otherwise, I'm giving probiotics. That is now somebody can answer this. Is what type of diet should be taken in PCOS? This we have discussed. So we want, high protein, less of carbohydrate, include carbohydrate, not too many calories at the same time, very properly planned diet. It has to be consistent and continued. This is about the diet. Now, what is this? Is taking metformin mandatory? No, it is not. From what age we can give metformin? Who wants to answer? Shashikala, metformin, what age you want to start?
Metformin, most of the time we start for the obesity and for the infertility management.
So reproductive age.
Reproductive age.
Because we are not catering the pediatric class, so we only know about what she said was right. In obese patient, how long tablet? This also we've answered. Hello, ma'am. Does PCOS symptoms like hirsutism and acne require medicine, or is dietary management enough? No, not dietary management. Definitely, hirsutism and acne require management by not only a gynecologist or a PCOS specialist, but also from a skin specialist. Okay, and you will also have to go to other beauty clinics and all where they do very good type of laser treatment. All that also should be incorporated whenever it is necessary. So just taking medicines will not help.
Basically,
Uh,
actually, hirsutism needs a long, prolonged treatment. Whatever hair growth has happened, we cannot change that. It is only the new hair which is coming we can prevent by giving these hormones.
Hormones at bay. Yeah.
Otherwise, they have to take care of the cosmetic part, laser, waxing, bleaching, other things like that.
Uh,
Other thing,
what?
all these things require a very long treatment, not of 3 months, 6 months. It may run for 2 years,
9
3 years,
months,
4 years.
minimum of 9 months.
Yes.
So, you know what I tell my patients, PCOS patients, that this PCOS that is there, it is genetic, it is there, and it is going to be there in your body. We cannot remove that genetic material and all. Maybe in future it may be possible to change, or there may be some alteration and all that, we do not know. But right now they have to have the lifestyle management until I shouldn't be saying until they're alive, right? They have to do it. There's no stopping, no stopping. It's not so difficult. It's not so difficult. Once it gets into your system, it becomes a routine. You know, that's why I call it as a discipline is most. Discipline is very important as far as PCOS is concerned.
In fact, they can develop diabetes later on. So these women should be very thoroughly, they should keep checking their blood sugar levels.
No, actually, I'll tell you. Whenever the PCOS patients come to our clinics, it is our duty also to teach them. And that's why our PCOS society is doing so many programs. Like Priyanka knows that how much we are going everywhere and telling people that how important it is to take care of yourself and to keep a record and continue to take care, because these patients who have PCOS, they will definitely most probably have this metabolic syndrome, and if they conceive they will have a gestational diabetes, and then after that they may develop diabetes, they may develop hypertension, all kinds of cardiovascular problems. That's why this is known as a metabolic syndrome. And I think the PCOS girls should take it a bit seriously, and it's very simple, no? Lifestyle management, if you do with the proper discipline and, you know, a little bit caring of your diet, sleep. It's so nice to sleep for long hours, right? Not too long, but yeah, properly 7 to 8 hours. And that's it. And a little bit help from your doctors. I think you'll all be fine. You will not get diabetes and all if you take care from beginning. And even if you get pregnant, you will not get gestational diabetes. Even if you get a gestational diabetes under the care of a proper doctor like Jyoti, Shashi, Sabita and Monica, you'll be all fine. You won't have problems, right? So I don't want to scare all of you here that if, by telling so many other things, like supposing you don't take care, then if you have gestational diabetes, then you will have a baby which will not be there in your arms, right? You may lose that baby, and later on you may have myocardial infarction. You may have other problems of severe hypertension and all that. So better to take care. Prevention is better than cure, especially so for PCOS. Now let us go. What important and main investigations to be advised for PCOS? This is a fantastic question. I don't know. Can I ask Priyanka, who is this person? I would like to know. Very intelligent. Because
Oh, okay. I'll have to check, ma'am. I need to check.
check, no problem. I just, if you come to know, it's okay. Otherwise, no issues.
It's Sarla Jain.
Sarla Jain, which place?
No, location is not
Not
reflected.
there. That's okay.
Yeah.
That's okay.
I've got a Sarla Jain in Bhopal.
I thought it's Ahmedabad.
I think she's a very, very close friend of mine. So if it is Dr. Sarla Jain, then hello to her. And
Okay. I was just joking.
yeah.
You know, actually, I'll tell you why I like this question. Because I see many patients, and then these patients already have gone to many doctors and then come to me, and there's no proper investigation, you know. So anybody can tell, Shashi or Sabita or Monica,
Yeah.
what do you do?
So, ma'am, Rotterdam's criteria consists of 3 criteria. Number 1, clinical menstrual irregularity or disturbed ovulation. Second is your ultrasound features. And third is your hyperandrogenism, which is measured biochemically.
I
So now,
think the question is laboratory
yes,
investigations.
ma'am. So that's why I'm coming to hyperandrogenism. All the biochemical investigations are therefore directed towards measuring hyperandrogenism. Now, the first question that adolescent PCO mother asks you that should we do the blood test? So here, yes, in an adolescent PCOS, because ultrasound is not recommended, along with clinical features, you have to assess either clinical hyperandrogenism or biochemical. So when you have to assess biochemical androgenism, hyperandrogenism, you have to do the blood tests. They can be free or total testosterone. Free testosterone is very difficult to measure in the lab, so we do total testosterone. We also do sometimes LH-FSH ratios. We also do sometimes dehydroepiandrosterone. So these are the commonest, androgens we measure in the lab. Having said that, as this woman goes to reproductive age group, then you can do ultrasound for her. The biochemical investigations can be reduced in frequency and amount according to the convenience of the patient. But in order to rule out virilizing tumors and other causes of hyperandrogenism, sometimes you may have to do. As fertility specialists, we are relying now less and less on biochemical investigations. We are relying more on clinical findings and ultrasound.
Yeah.
Yeah.
So very good.
17-hydroxyprogesterone and things like that to rule out all those other causes apart from ovaries and all that Dr. Monica suggested. We can add. And also TSH, normally we see that
We have to do T3, T4, TSH, or because PCOS and thyroid problems go hand in hand.
Very common.
You have to, if you don't do, it's not correct. Another thing in fertility age group, AMH has to be done. No need of doing insulin.
Yes.
Yeah. I do include insulin because of some reasons of completion, and then I also look for insulin resistance. Okay, now let me ask, like a real teacher. Okay, how do you examine a patient clinically when she comes to your?
That if she has her nape of neck has that blackishness, that
What
means
is that known as? What is that known as?
Acanthosis nigricans.
Acanthosis
Acanthosis
nigricans.
nigricans.
There's a whole chapter on that, and recently there's a very
but
good
these days they say that if the knuckles are dark, no? If these knuckles are dark, again one can, it is also a sign.
Okay, well, that is done. Then anything else?
Folic acid and vitamin D deficiency. Knuckles are dark.
What other things are you going to see?
Madam, hirsutism is nowadays, we had a very beautiful panel in Fusion, Dr. Rishma Pai's conference. Hirsutism is nowadays very difficult to assess because all these girls go to the parlor.
That will leave. If the patients. Okay, now I will tell you because we have to answer other questions also. So once the patient comes to your OPD, even looking at her, you can find out. First of all, she may be obese or she may be very thin. Two things, lean or obese. Then you see for small skin warts. And you have to examine properly. First of all, proper examination. And before examination, you ask her, do you have small warts? You will see that most of these patients will have skin warts. Sometimes they don't understand skin warts. You have to tell in their local language, मस्सा है क्या तुमको? हाँ मैडम, इधर है, इधर है, इधर है. That means what? That is an indication of insulin resistance, right? Such a simple thing. You don't have to do any investigation for that. Then another thing, you said that no, that laser and all. Okay, laser done, but you tell her to open the upper body clothes and see, then you can ask first, do you have hair in the middle of your chest? Do you have hair on the nipples? You will be surprised. So many patients will say, yes, ma'am. Okay. And as she said, acanthosis nigricans, and other thing, testosterone, if it is high, male hormone, that's what general public. Many of these patients have lots and lots of hair on the entire leg
Bodily hair,
abdomen. Okay,
Yeah.
so there are so many things that just by the
Looking
simple
at the patient.
signs we can diagnose without any this invasive. But having said that, I always we have in our center what is known as the PCOS profile, and I get everything. Now I have joined another hospital. They didn't know what is PCOS profile. Then I had to tell my nurse from this hospital, send me all the tests. So then we get all those things even there. So it is like that. We the what the
One more message I
eyes
want,
don't know, the mind will not, what the mind doesn't know, the eyes will not see. Right.
ma'am,
So we
one
have to be
message,
very vigilant. Yeah.
one more message I wanted to give was, which I
Yeah.
got again from that conference, was if that lady is on OCP, do not assess the androgens for
Hmm.
3 months. She has to stop the OCPs, and after 3 months, you can assess because all the levels will be low because of the oral contraceptive pill.
Very good. This is a very good point. Very good. Yeah. Um, yeah, wait 1 minute. See, they're also asking whether for hirsutism medicines are required or only dietary management is enough.
Madam,
What do you
hirsutism
say?
totally dermatological treatment. Without the help of dermatologist and endocrinologist, you cannot treat hirsutism effectively. And the permanent methods of hair removal are very expensive. Then they also depend upon the skin color and the hair color. In fair skin, the black hair is easily removed by laser, but dark skin and dark hair is difficult to remove. The laser has to be used by a skilled person, and it is very costly. Repeated sessions are
Yeah.
required.
So,
Basically,
Monica, to tell them in a simple language, we have the answer for this is that hirsutism is a hormonal disorder, right?
yeah.
Because of the hormone. So it's better they go to the proper doctor. And also, as you said very rightly, all the hormones have to be properly done and regulated, and then go to a skin specialist and also a beauty clinic where they laser and all that. It's a combo of treatment. It's not. Then there are also very interesting. I think your evening OPDs may be a little bit hampered today.
When some girls ask about shaving the hair, is it advisable? Some are using, these Jyoti. I wanted
One of my
I
patient,
think
Monica.
epilator is one thing, Dr. Monica. Epilation can be done. I mean,
what
for the bodily hair.
epilation
No,
means.
actually, one of my patients recently came 2 days back, and then she said, I don't have any hair. I don't have any hair. But then I just put, I'm a little suspicious type of a lady. I just put because I knew she's PCO. I just put my hand on her leg, and then I could feel the hair, that
And
pricky.
roughness.
She said, no, you have hair. I'm sure you have hair. Have you got anything done? Yes, ma'am. I got laser done. So I said, you got laser done, and then, what type of laser in this laser? This thing is not like that. I don't have prickly for this thing. Then she said, no, she came from a small place in Rajasthan. She said, then I got laser there. She said, yes, they're telling it is laser, but they do it with blade. What ullus they make nowadays. So please be very careful. This is to the audience who was listening. You read about it. Now, Dr. Google is also there. Use Google for some proper things like, all this laser and all, not for the medicines. So you will know what those doctors are doing, and don't go for, something which is not genuine. Yeah. Let's now move on to another. Yeah, this investigations is over. One girl has asked about pumpkin seeds. Uh, I think PCOS, almost all girls are there, right, in the audience? I don't know. Priyanka,
Yes, man, it's a mix of both girls and women.
there are no men.
Difficult to say now. We'll have to check in the back end if we have men or not.
Because I wanted to have one program, Priyanka, in one of the clubs here in Ahmedabad. When it was the person who is the head, he's also a doctor. He says, Dr. Kanthi, what to do? Generally, we have these health things in the early morning in the club. we have 1 or 1.5 hour, everybody comes. But they said that these ladies won't come in the morning, they'll only come in the afternoon, and it is not for men. So from that day, I was thinking men should know what is happening to their daughters, their wives. Why are the men not attending?
Agree.
From which age you can start COC in adolescence?
Ma'am, we have already addressed that
We have
question.
addressed that. Sorry.
There's only one question that needs to be addressed, that is complications of untreated PCOS.
The last one, complications of untreated PCOS in future life.
Yeah, that's the last question we can take.
Untreated PCOS can land us up anywhere. It can lead on to infertility. It can lead on to cardiometabolic syndromes. It can lead on to even endometrial hyperplasias and cancers, endometrial cancers. So this is a disease. If ignored, it can hit any age group and throughout life. So right from adolescence till menarche, from menarche till menopause, it presents in various forms. So if the patient initially it presents with hirsutism, acne, irregular cycles, and then in your reproductive years it presents with infertility, and then if you are once you conceive, there are problems of miscarriages. During pregnancy there could be gestational diabetes, even gestational hypertension and IUGR, preterm babies. And once you have delivered, then later on you can develop diabetes 7, 8, 9 years down the line, or you could develop all these cardiometabolic syndromes.
Yeah. So I differ a little bit here. And Priyanka, there's one more question I just remembered, which I will tell later on. But to what Jyoti said, there are, however, we can't put the entire class of PCOS subjects in one group and say that they all, there's a small group where they're quite mild, they really do not have too much of a problem, and they have a little bit of problem in conceiving, they conceive, and then that's it. And those patients are fine if they don't take lifelong. But most of the other patients, what Jyoti said was right. It's better to take care lifelong. Yeah. And one more, because I've seen so many patients who do have some minor, the phenotypes are a little different in that. Supposing they don't have too much of hyperandrogenism, they just have a little bit of problem in conceiving, all that. So it's different. It's not one mantra for all the PCOS patients. We have to really see what type of phenotype is she and all that. So very mild degree, maybe they may not require that much of care. Now coming to that, one more question, maybe this is the last question. Somebody had asked about myoinositol. What is myoinositol, and is it a drug for PCOS? How does it act and all that and all that? So can I tell a little bit of myoinositol and then you all tell about the medicine? Okay. So it's like this. Inositol is there in our bodies, and normally inositol is excreted in the urine. Okay. But in patients of PCOS, inositol is excreted around 5 times more than the normal subjects. So when so much of inositol is excreted, that's the place when we thought that replacing this inositol will be good. And basically, inositol is used in cases of psychiatric ailments where they give very large doses. They give 2 grams of inositol 4 times a day, etc. That is the dose in psychiatric patients. But then they found that this inositol, because so much inositol is lost in the urine, can be replaced in patients of PCOS. And so this myoinositol has come in picture, and we've seen there's a lot of benefit with myoinositol. Patients get good sleep, even with myoinositol, and also melatonin. Melatonin also gives sleep. So others can answer the other things. Yeah, Shashi?
Yes, ma'am.
Myoinositol का बोलो कुछ.
As you said, madam, myoinositol is already present in the body, and it's a nutraceutical type of drug. And we are generally giving it to a patient who comes with a complaint of infertility to decrease the insulin resistance, better follicular development, and good sort of ovulation. And in IVF, it helps in getting good quality of, embryo. And it has to be given in some proportion of myoinositol and dechirioinositol in the ratio of 40:1. So it is available in that combination, and it is helpful in our getting rid of insulin resistance.
Very good. I think we are done, Priyanka. We have.
Yes, ma'am. I think we have exceeded our time
Yeah.
also. And we have
Thank
covered
you
all
for
the
extending the time.
Yes, we have
I
covered
thank
all the
all my panelists. Fantastic. All of them are real experts in PCOS. Thank you for coming and giving your valuable time here. Thanks, Priyanka, for such a
Thank you, ma'am. Thank you all.
Thank you,
Thanks
ma'am.
for
invitation, ma'am.
Thank you,
organizing this.
Priyanka.
Thanks
And
for involvement.
Yeah,
Dedicated
thank
product is awesome. It is very nice to have such platforms where we can at least connect to the public and people who we can at least give them clear guidelines and knowledge about, rather than they getting misinformed that way.
Right,
Thank
right.
you.
Actually, initially I wanted to do infertility only. I kept telling Priyanka, but I had no time initially. And then when I took this subject, I thought it's interesting. Myths and
Yes,
misconceptions.
ma'am. Much needed, ma'am. Thank you all the panelists. Thank you, Dr. Kanthi, ma'am. You have put so much of efforts in organizing and conducting this webinar today. Also, thank you, Dr. Jyoti Malik, ma'am, Dr. Monica Singh, ma'am, Dr. Shashikala, ma'am, Dr. Sabita, ma'am. Thank you for giving all your in-depth insights. I think it was a very comprehensive and a good discussion on myths and misconception. Also, we have patiently answered to almost all the questions that were addressed to us. So, anyways, and thank you all the viewers who joined, and I hope that you have found this discussion helpful. If you have any questions, you can always contact us on 9152919221, or you can write to us at manager.vijeta.pcos@gmail.com. We keep coming up with these kind of panel discussions towards the end of each month, so we'll be keeping you updated on the same. Thank you once again.
Thank you. Thank you.
Thank you.
Thank you. Bye, ma'am.
Bye. Bye.